When the supply chain breaks down, the pharmacy is one of the first places that shows you exactly how fragile the system actually is. Not because pharmacies are poorly run. Because the modern pharmaceutical supply chain operates on a just-in-time inventory model that assumes trucks will keep arriving on schedule, that power will stay on, that the distribution network between the manufacturer and the shelf will function without interruption. When any of those assumptions fail, the shelf empties, and the medications that disappear first are not random. They follow a predictable pattern driven by demand volume, supply chain concentration, and the urgency of the people trying to obtain them. Every documented supply chain disruption, every regional disaster, every extended infrastructure failure of the last 20 years has produced the same sequence. Tonight we go through 6 specific medication categories. What they are, why they disappear first, and what you can realistically do right now while the system is still functioning to make sure your household is not caught without them when it is not. Subscribe now and stay for number 5. It is the category that affects a larger percentage of the adult population than any other on this list, and the one whose absence creates a medical crisis that has nothing to do with the disaster that caused the shortage. 1. Antibiotics. Antibiotics disappear first because infection becomes a statistically near certain problem in any extended disruption scenario. Compromised sanitation, wounds from debris and physical labor, waterborne pathogens when water treatment degrades. The entire category of infection that modern medicine handles routinely with a 10-day course becomes a serious and potentially life-threatening problem when the antibiotic supply chain is not functioning. The challenge with antibiotics is that they require a prescription in the United States and most developed countries. Your realistic options are limited, but they are not zero. Talk to your physician now about a standby prescription for a broad-spectrum antibiotic for documented emergency use. Some physicians will accommodate this request from established patients with a history of responsible use. Fish antibiotics, which were widely discussed in preparedness communities, are no longer legally available without a prescription following FDA reclassification. The route that remains is the honest conversation with your doctor before you need the prescription, not the week the pharmacy shelves are empty. 2. Insulin and diabetic medications. Insulin is the medication whose shortage is most immediately life-threatening. A type 1 diabetic without insulin faces a fatal outcome within days. A type 2 diabetic without medication faces a serious deterioration in condition within weeks. The diabetic population in the United States is approximately 37 million people. In any regional disruption, the demand spike for diabetic medications against a disrupted supply chain creates a shortage that is both predictable and severe. The specific action for any household with a diabetic member is to maintain the maximum insurance-permitted supply at all times and to have a direct conversation with the prescribing endocrinologist about emergency supply protocols. Insulin storage also requires specific temperature management. Most insulin formulations remain stable at room temperature for approximately 28 days after opening. Understanding your specific formulation's storage requirements and planning accordingly is the preparation that most diabetic households have not done before they need it. 3. Blood pressure and cardiac medications. Beta blockers, ACE inhibitors, calcium channel blockers, and the full category of cardiovascular medications represent the highest volume prescription category in the United States. Nearly half of American adults have hypertension. The medications that manage it are taken daily, indefinitely, and cannot be safely discontinued abruptly without significant cardiovascular risk, including hypertensive crisis and cardiac events. These medications disappear in the second wave of any pharmacy disruption, after the acute emergency medications and before the longer-term chronic condition drugs. Their volume of demand combined with the abrupt discontinuation risk makes them one of the highest consequence shortage categories for the general adult population. The preparation is a 90-day supply maintained at all times through your prescribing physician and your insurance plan. Most insurance plans permit a 90-day fill. Some permit emergency overrides for additional supply. Know your plan's policy now before a disruption makes the conversation urgent and the options limited. 4. Psychiatric medications. This category carries a specific and underappreciated risk profile in a disruption scenario. Antidepressants, antipsychotics, mood stabilizers, and anti-anxiety medications cannot be safely discontinued abruptly for the majority of people taking them. The discontinuation syndrome from abrupt SSRI cessation produces severe neurological symptoms. Abrupt discontinuation of antipsychotic medications in patients with serious mental illness produces outcomes that are both medically dangerous and community destabilizing in a scenario where medical infrastructure is already compromised. The psychiatric medication shortage problem in a disruption is also compounded by the fact that the stress of the disruption itself increases the severity of the conditions these medications manage. The preparation is identical to the cardiovascular category, maximum permitted supply maintained at all times. An honest conversation with your prescribing psychiatrist or physician about emergency supply protocols before the system is under stress. 5. Pain management and anti-inflammatory medications. This is the one. The category that affects a larger percentage of the adult population than any other on this list and whose absence creates a compounding medical problem in exactly the scenario where physical injury and exertion are most likely. Over-the-counter pain and anti-inflammatory medications, ibuprofen, acetaminophen, aspirin, and naproxen clear pharmacy shelves in the first hours of any serious disruption alongside water and batteries. They are purchased in volume by everyone simultaneously because everyone anticipates needing them and the barrier to purchase is zero. The consequence of their absence is not just discomfort. In a physical emergency scenario involving injury, manual labor, and elevated stress, the inability to manage pain and inflammation degrades functional capacity in ways that compound every other challenge the situation presents. Fever management without acetaminophen in a household with children is a medical problem. Untreated inflammation from physical injury reduces mobility at the exact moment mobility matters most. Buy meaningful quantities of each formulation now. Check expiration dates and rotate them into regular household use. Store them in a location that is accessible without power. The total cost for a 3-month household supply of all 4 formulations is under $30 at any mass retailer. The cost of not having them in the first week of a serious disruption is significantly higher than that. 6. Wound care and topical antiseptic supplies. Not a medication in the pharmaceutical sense, but treated as such by the people who need them and absent from shelves for the same reasons and on the same timeline. Topical antibiotic ointment, antiseptic solution, wound closure strips, and sterile dressing materials disappear in the first disruption buying wave because the logic is identical to the oral antibiotic logic. In a compromised environment, infection from wounds is an expected problem and everyone reaches for the prevention simultaneously. The specific items worth maintaining in meaningful supply. Sealed tubes of triple antibiotic ointment in quantity, not a single tube. Betadine or equivalent broad-spectrum antiseptic solution. Wound closure strips for lacerations that would normally require clinical attention. Sterile gauze pads in multiple sizes. Medical tape in a full roll, not a partial one. These items have multi-year shelf lives when stored sealed and cool. They are available today at prices that will feel completely reasonable until the moment they are not available at any price. 6 categories, all of them driven by the same underlying logic. The pharmaceutical supply chain is a just-in-time system that functions perfectly in normal conditions and fails predictably in disrupted ones. The sequence of what disappears is not random. It is driven by volume of demand, urgency of need, and concentration of manufacturing in supply chains that stop moving when the system is under stress. The window to build your household medical supply is right now. Not the morning of the disruption, not the afternoon the news makes it real. Right now, while the shelf is full and the prescription can be filled on a normal Tuesday without urgency or competition. Drop a comment below and tell me which of these 6 categories your household is most underprepared on. The honest answers are what make this channel useful to the people who need it. Subscribe if this is the preparedness content your feed has been missing. And the next video covers the medical skills, not supplies, that every household should have before a crisis makes learning them impossible. What you can realistically learn, what actually requires professional training, and what the priority sequence is for a civilian with no medical background. That one is coming soon. Do not miss it.